Welcome to the NMI podcast. And what a privilege today. We're speaking with Dr. Alan Gaby, who literally wrote the book on nutritional medicine and is one of the great pioneers of our time of nutritional medicine in general. And before we get into this conversation, I want to give you a background into Dr. Gaby's work and achievements. He received an undergraduate degree from Yale University, an MSc in an MS in biochemistry from Emory University, and his MD from the University of Maryland. He's been in private practice, was in private practice for 19 years, specializing in nutritional medicine. He's the past president of the American Holistic Medical Association, has given expert testimony to the White House Commission on Complementary and Alternative Medicine on the cost effectiveness of nutritional supplements. Is the author of a number of books, including Preventing and Reversing Osteoporosis, A Doctor's Guide to Vitamin B6, and is co-author of The Patient's Book of Natural Healing. He's written numerous scientific papers. I'm a huge fan of his scientific publications. They're beautifully articulated, very intelligent, really pull apart the science from a clinical perspective. But has written a lot in the field of nutritional medicine and was contributing editor for the Townsend Letter for Doctors and Patients from 1985 to 2023. He was also contributing editor for what was a brilliant journal, Alternative Medicine Reviews, from 1996 to 2010. And over the past 43 years, Dr. Gaby has developed a computerized database of more than 28,000 individually chosen medical journal articles related to the field of nutritional medicine. He was professor of nutrition and a member of the clinical faculty at Bastyr University in Kenmore, Washington from 95 to 2002. And in 2010, and we're going to speak about this, Dr. Gaby completed a 30-year project, which is the textbook Nutritional Medicine, which is now in its third edition in 2023. So just briefly, Nutritional Medicine is a science-based, extensively referenced textbook written for healthcare providers and for non-practitioners who are interested in viable alternatives to conventional medicine. And it really discusses literally hundreds, probably thousands of therapies that could be used as an effective, low-cost, low-risk alternative to adjuncts and adjunct to conventional medicine. So no small introduction, Dr. Gaby. And I have to say personally, it's a real privilege to have you on the call. I feel like, what an opportunity to speak to one of the great pioneers of this field. So I really appreciate your time.
Well, thank you for the kind words, and I'm happy to meet you and happy to be on your podcast.
No, it's a pleasure. So, a good place to start is just to give listeners a bit of color around your journey and the work that you're doing. And, it's a big question, considering your legacy and contribution to the field, but how did you get into nutritional medicine?
Yeah, well, I think it's an interesting story. I grew up in a medical family. My dad was a surgeon, and he strongly urged me, maybe even pushed me to go into the medical field. I really didn't have any interest in it. I didn't like giving drugs and cutting people up. And so went to college, didn't really try very hard, and managed to get rejected from medical school, which was fine because I didn't want to go anyway. And then the following year, when I was teaching school, I read a book by Roger Williams, a noted biochemist who had discovered the B vitamin pantothenic acid. He had named folic acid. Foliage comes from leafy greens, so he called it folic acid. He wrote a book called Nutrition Against Disease, and he cited 1,100 references, most of which I had never heard of in medical school, showing that dietary modifications and nutritional supplements can be used for preventing and treating many illnesses. And this was in 1973. The amount of literature out there then was much less than it is now, but there was enough for me to be intrigued. And one day, shortly after that, I had what you might call an epiphany. Einstein said something like, epiphanies are God's way of remaining anonymous. But it just hit me in a moment of clarity that you are going to learn everything you can about nutritional medicine, and you're going to teach the world what you learned. And I went from kind of aimless to having a purpose-driven life in an instant, and got really motivated, went to medical school, got a master's in biochemistry along the lines, because biochemistry is a good background for nutrition. And I also had to show the medical admissions committees that I could be a good candidate. So I got all A's in graduate school, went to medical school with the aim of practicing nutritional medicine. So I learned what you're supposed to learn in medical school. And on the side, I read as much as I could. After medical school, I was fortunate to be able to join the practice of a pioneer in this field, Dr. Jonathan Wright. And so I was in his practice and he taught me stuff. And I spent 3 days a week seeing patients and 3 days a week going to the library, going through the contents, table of contents of all of the relevant medical journals in the library back to 1900. It took me 2 years just to go through this. And then I continued to look at the current evidence and just found many thousands of articles, categorized them, summarized them. And then Microsoft came out with these programs that made it possible to do this work in 20 years faster than I would have. Microsoft Access, where you could categorize, Word, where you could do word processing. So basically, I spent probably the equivalent of 20 years of full-time work analyzing and looking at this work and seeing patients also, because, people write stuff in medical journals and you don't know whether it's really a placebo effect or whether they even made it up. Sometimes people make stuff up. So I tried many of the things that I read about, saw what worked and what didn't in medical practice, and then devoted full time to categorizing and writing this book. It's got 16,800 references, and books this size typically are written by between 50 and 100 contributors. And I wrote this by myself, but I spent almost my entire life on it. And the point of it was to try to figure out, A, what works and what doesn't, and B, how to use it safely and effectively, particularly in conjunction with control their symptoms without medication. But it's up to them. They have to follow diets and they have to take various supplements. The good part is that the supplements, when used appropriately, are very safe. There are some potential side effects, and you need to know about that. And that's why you can't just go to the health food store and buy a bunch of stuff and take as much as you want. So there are things you need to know as a practitioner, but with expert utilization of nutritional therapy, I've seen hundreds of people that I taught seminars. They email me and they write back and say they're getting better results than they ever have before, and they're never going to go back to what they used to do.
Yeah, that's incredible. That's quite a journey. And you've mentioned a few real pioneers in the field there, like Roger Williams, who came up not only, with his work on vitamins, but biochemical individuality, which was absolutely landmark work that went on to influence the field of nutrition and functional
Absolutely,
medicine
yeah.
in different ways. And also Jonathan Wright, who's, I think you and Jonathan are, when I look at the real heavyweights of nutritional medicine are, some of the great pioneers of this field. So, what an incredible journey and result. Like it's a huge project. And I think this textbook, as you point out, is really written to, teach the world and healthcare providers about nutritional medicine. Why do you feel this book is really important? Like personally, I think one of the challenges people face is finding information and filtering
Yeah.
through it. For me, this book does that. That's why it's so valuable. But what's your take?
Well, what I tried to do is separate the legitimate from the overhyped. I mean, as you know, there are many salespeople in this field who I wouldn't say snake oil salesmen, because snake oil is actually very high in omega-3 fatty acids and probably does have some medicinal benefit. But you know what I mean? People are peddling things sometimes for financial gain, and they don't work or they're not worth it. And then
Yeah.
there are other things that are low cost and they have good research behind them. And then there's things that may not have a double-blind study behind it, but it's kind of like, why not? Not doing conventional therapy is not going to kill you right now, unless certain cancers and things like that. You got to get started right away. But most medical conditions, it's okay, it's safe to try the safer treatment first, and then if it doesn't work, then you can go on to the big guns. So in addition to citing the randomized controlled trials and well-documented stuff, there are thousands of articles on case reports or uncontrolled trials. And I found that a lot of those things did work in clinical practice. And you can tell the difference between a placebo effect and when something works, because
Yeah.
a placebo effect doesn't last longer than 3 months.
Yeah.
So, for example, I gave somebody a B12 shot one time, and you know the old saying about whether that helps fatigue, and a lot of people don't believe it. There is one randomized controlled trial supporting that, but I gave this woman a B12 shot. Said, I don't know if it's going to help you or not. Let me know. She comes back. I said, how'd it do? She says, Doctor, I cleaned the house. I said, well, that's what did you do? I asked you if it worked. She says, Doctor, I have not cleaned the house in 10 years. So when you hear stories like that, another guy woke me up at 7 o'clock on a Saturday morning. He was a father of one of my friends, so he felt it was okay to ring my doorbell on a Saturday morning at 7 a.m. He says, Gaby, you gave me all this energy. Now find something for me to do with it. So when you hear stories like that, and yes, there are placebo effects, and sometimes that's why people get better. But also, you see these people who have such glowing reports, and I try not to push the placebo. Although people know that I care about them and I want them to get better, I try not to say, "Oh, this is a wonderful therapy," because I don't know half the time. And I listen to people, and you can tell the difference between, yeah, I think this helped, and wow, this is the most amazing thing that's ever happened.
Yeah, yeah. I mean, that's a great concept in itself, is the idea that these nutritional interventions are very safe, often low cost, and that, theoretically there may be some plausibility to it working. So why not try it?
Yeah.
Like it's a really different way of thinking versus, say, drug therapy. Um,
Yeah, well, drug therapy, typically they call it the magic bullet, where you use a specific drug to do a specific thing, and it's got often side effects. And often drugs are very effective too. Nutritional therapy works on a different concept, that nutrients work as a team. And that's one of the things that Roger Williams emphasized in his writing. And it sunk into me as a concept. So you want to do dietary factors that might help. You want to do nutritional supplements that might help. And combinations of nutrients, at least according to clinical experience, often work better than individual ones. So rather than the single shotgun therapy, the magic bullet, if you use a military analogy, I would call that magic shrapnel, because lots of different things spew out there, and in this case, have a healing effect. And the other interesting thing about nutritional therapy, arthritis, and this was based on reports back from the 1940s and followed up by a double-blind study from the 1990s. And it's one of the most effective therapies that I've seen. It does have a potential for liver toxicity with high doses, so you have to check periodically on liver enzymes. I've never actually seen that happen, but you have to watch just to be sure. So this woman comes back, and I said, how are your knees doing? And she says, well, my knees are better, but also I feel 30 years younger. My mind is sharper. I sleep better, and all these side effects. So that's the good part of nutritional medicine too.
yeah, exactly. It's working on like multiple, you know, outcomes really. That these nutrients have really diverse effects throughout physiology. Yeah.
Yeah.
Makes a lot of sense. Just jumping back to your textbook, how did you achieve something so epic in scope and size? Like this is a, decades long project with, a tremendous amount of references. Like what was can you give us some insight into the workings of this and the process?
Well, like I said, I was given this purpose, and I just kept at it. And I used to go to the holistic medical meetings back in the 1980s, and I'd tell people, I'm writing this textbook. And then in the 1990s, how you doing? I said, well, I'm working on this textbook. And then in the 2000s, it's like, you're still working on that stupid book? But I would spend at least 20 hours a week for about 30 years. And
Wow.
like I said, when the computer programs, when the software came out where you could categorize and write things better, I got to a point in 2008 where it's okay, I've collected all the research, I've categorized it, and now it's time to start writing. And it took about 2 years to put all the stuff together after the other 28 years of collecting and summarizing and analyzing. So
Yeah.
it's just something that this is what I do, and I just stuck with it and until it was done.
Yeah. Yeah, yeah. I remember Joe Pizzorno saying something like that when the first edition came out. He's like, "This is this book that Alan's been talking about for decades," and like now I understand why he was talking about it for decades because
And
it's
my biochemistry professor from medical school back in the 70s, I remained friendly with him over the years, and I sent him the book in 2011, and he wrote back and said, I have to admit, I never thought you were going to finish it. But, and then the updates, that took a lot of work too, because new stuff comes out, but it was way less because the book was already there. The concepts were the same. The basic structure of the therapies was the same, but updating it, just whatever new research came out between 2010 and 2016.
Yeah, that makes sense. And that relates to a question I wanted to ask you because I think a common criticism I hear about textbooks and research in general is that it quickly becomes outdated. And, I feel like this book sort of transcends being outdated because of the way it catalogs information. But do you want to speak to that idea that, things become outdated or?
Yeah, well, outdated is relative. I mean, if I had a mechanism of adding one study to one chapter and rewriting a paragraph every time something came out, I would do it. But there's no mechanism to do that. As far as whether there's a catastrophic problem by using the first edition or the second edition as opposed to the newest, I haven't seen anything like that. The only negative of not being up to date is you might find out that something you thought worked based on an uncontrolled trial. Now there's a controlled trial and it didn't work. So you might want to eliminate that therapy. Also, in the past 10 or 15 years, I've become much more aware that some people are making up research and publishing papers on work that they never even did. And it's become an epidemic, unfortunately, in places like Iran, Egypt, China, a little bit in Japan and Italy. I took out about between the second and third edition, I took out about 12 papers
Hmm.
from between the second and third, or else I said, my understanding of this is that I have no confidence in this. And then I wrote in the preface of the third edition how to spot potentially fraudulent research. But as far as whether this comes outdated, some of the chapters, for example, on food allergy, um, it's almost exactly the same between the first and the third edition. It's a conceptual approach. You do an elimination diet, you do individual food challenges one at a time. The chapter on blood sugar analysis, minor tweaks here and there. So yeah, stuff from the 60s, for example. We were going to probably talk about this later, but there's research on the treatment of fatigue with potassium, magnesium, aspartate. I can get into the details if you'd like later, but that was from the 60s. There are 3 or 4 double-blind trials from the 60s showing that it's useful for non-specific fatigue, and nobody's ever followed it up.
Hmm.
There was actually a prescription drug in the 60s, and they took it off the market because the Food and Drug Administration changed its rules on what can be approved. Um,
Hmm.
but so the treatment works. It's one of my favorite treatments. Patients say it really helps their fatigue. But like I said, no research on that after around 1964.
Hmm.
And I didn't learn about that in medical school. I went to medical school in the 70s. Nobody mentioned it. My son is now in medical school, and we'll talk about a disease that he's studying. And I say, well, did they say that you can use this nutrient for that? He says, oh, no, they never say anything like that. So I was dismayed that they left all of this out when I was in school. And I guess I'm still somewhat dismayed that they're not teaching it. But as you get older, you don't let yourself get dismayed. You just look at it philosophically.
Yeah, yeah, no, that makes a lot of sense. It's yeah, same problem, today is that there's relatively slow adoption of nutrition in medicine in general. But, getting back to your point of citing some of this older work in your book, I think for me that's one of the real values of your reference is that you have this incredible catalog of studies dating back to the beginning of studies pretty much, which you are very hard to find otherwise. Like if you're doing literature reviews or searches or like some of the like I'll go to your book to find these older papers that are still relevant today, I think.
Yeah, they don't come up on PubMed. A lot of these.
Yeah.
There's some from the 30s and 40s. my oldest one was from 1902, and it was an abstract published in the Journal of the American Medical Association on using hydrochloric acid for the treatment of something called gastrogenous diarrhea. It's a kind of diarrhea related to lack of stomach acid. And I had not seen any follow up on that. I think they might have mentioned it later on in some of the other studies from the 30s and 40s, but nobody talks about using hydrochloric acid anymore. It kind of fell out of favor in the 1940s. And, we know nowadays that if you shut off the acid with proton pump inhibitors, you cause a multitude of problems. But people have not translated that to maybe we should be treating absence of stomach acid with hydrochloric acid. But anyway, so that from 1902, I've used that as a therapy for this particular condition, and it seems to work.
Yeah, yeah, and I think in a big part, thanks to you, it's still a popular, like empirical therapy in nutritional medicine circles, but not well studied since then. All the data's really old.
Right.
Yeah, yeah, no. So that leads us into, getting a bit of your perspective around nutritional treatments that are valuable but often overlooked in medicine. I mean, you've got incredible perspective in that area, and it'd be fun to just tick off a few examples. So let's jump into that magnesium aspartate for fatigue story and
Yeah.
unpack
Well,
that.
it was 1959, and there was a physiologist from France, and he published this paper, and he said, I think that fatigue is simply inefficient metabolism in the mitochondria. It's like, okay, that makes sense. Of course, there are many different causes of fatigue, but as a concept, that seemed reasonable. And he looked around for various substances that were available at the time that might improve mitochondrial energy metabolism. And potassium magnesium aspartate was being used. So that's the potassium salt of aspartic acid plus the magnesium salt of aspartic acid, and they put them together in a pill. So they call it potassium magnesium aspartate. And it was being used in Germany at the time as a treatment for heart failure.
Hmm.
So he said, all right, well, this makes sense. Potassium has a number of effects on cellular function. Magnesium, more specifically, is involved in the conversion of ADP to the energy substrate ATP. And the aspartate is an amino acid that feeds right into the Krebs cycle, which is involved with energy metabolism. And furthermore, Hans Nieper, a German physician, had written that aspartate is a mineral transporter, that it actually pulls the magnesium across the membrane into the mitochondria. I don't know whether that's true. There's been very little follow-up of it. But in any event, the physiologist got some rats. They didn't sign the consent form, but he experimented on them anyway. And he gave half of them the potassium magnesium aspartate, and half of them didn't get it. And they got the usual feeding that rats got. And then he put them in an ice bath and timed how long they would swim before they gave up and sunk to the bottom. And to his credit, he did pull them out, did not let them drown. But what he found is that the ones given the mineral aspartates swam significantly longer before exhaustion than those given just the standard chow. So based on that work, a number of double-blind studies were conducted in various countries, most of it in the United States, where they found that people with unexplained fatigue, they took 2 grams a day of potassium magnesium aspartate. That counts the weight of the aspartate and the potassium and the magnesium. And the other half got a placebo, and approximately 85% of the people that got the active treatment reported improvement in fatigue, whereas only about 15 to 25% reported improvement with placebo. And there were 4 or 5 studies that confirmed this. And as I mentioned at the time, Wyeth Laboratories came out with a drug called Spartase. And that was potassium magnesium aspartate. And they marketed it for the treatment of fatigue. It was out for a couple years. And then the thalidomide disaster occurred, where in the UK this happened. Thalidomide was banned because mothers took it during pregnancy to treat, I think it was nausea of pregnancy. And kids were born without limbs. So based on that, the Food and Drug Administration and Congress in the United States changed the rules that said it's much harder to get things approved, and you have to prove efficacy, not just safety, which was kind of a non sequitur because thalidomide had nothing to do with effectiveness. It was a safety issue. But
Hmm.
they took that reason to say now you have to prove efficacy and nobody was going to put up millions of dollars to prove that this aspartate was effective for fatigue. So they just took it off the market.
Hmm.
And then about 20 years later, the nutritional supplement companies came out with it. But as you know, they're not allowed to tell you what it's for, or
Yeah.
else the FDA brands it an illegal, an unapproved drug because of mislabeling if you tell people what it's good for.
Yeah.
But
Yeah.
I'm telling you what it's good for because I'm not selling it.
Yeah, exactly. Yeah, no, thanks for that. I mean, that's an incredible history. And it, from your perspective, is it being used widely today or is it just forgotten?
Well, most of the major nutritional companies offer that as one of their supplements. I don't have a lot of contact with practicing doctors now, but it's in my chapter on fatigue. I go through a detailed analysis of it, and I know there are people using it. As far as I mean,
Yeah.
the conventional medical community does not know about this stuff.
Hmm.
And the chiropractors, some of them, the naturopathic doctors, some of the dietitians, they're all interested in this. Then there's the integrative medicine doctors who are interested, but they're a small minority.
Yeah.
Um, and I think we just need to get people. This stuff is not that hard to do. I mean, you can be good at it, or you can even be okay at it. And if you're just okay at it, you're going to help a lot of people. So, my goal has been over the years to get this into medical schools, and so far that has not been successful. But what has been successful is a growing interest in the field among the public, and more doctors. It's slow, but more and more doctors are getting into this alternative.
Yeah, no, I think you're right. And that accessibility today of information to the public feels like it's driving, doctors and medical professionals to become more aware of these therapies. So
Yeah.
it's a bit like a grassroots movement based on availability of information that just wasn't there before.
It is, but they're not teaching the doctors this. What they're teaching them is, does this therapy interact with the drugs that you're prescribing? And you have to know that.
Yeah.
But they're not going. If you go to WebMD or some of these online review articles, they'll mention it and they'll say, well, they say this, and there's not good evidence that it's true.
Yeah.
But
Yeah. Yeah.
good evidence is in the eye of the beholder. A lot of times, if you look at, say, the practice guidelines in cardiology, 70% of the guidelines are based either on expert opinion, which is basically somebody thinks something, or observational studies, which, as you know, do not prove causation. So you got to go with what you've got. And if you've got poorly documented dangerous therapies versus poorly documented safe therapies, I know if I get sick, which one I'm going to try first.
It's a good way to look at it. Absolutely.
And I don't want to say nutritional medicine is poorly documented. There are probably 2,500 randomized controlled trials that I cited in the book.
Yeah. Yeah. I mean, that is the definition of pretty well documented. I mean, there's, disparity in the quality of those trials, but that's a lot of evidence.
Yeah.
Yeah. So carrying on the theme of you know, useful therapies that aren't used much, what another one I wouldn't mind discussing is riboflavin for migraines. Do you want to speak to
Yeah,
that?
sure. So there's evidence that people with migraines have a defect in their capacity to manufacture ATP in their brain. So their energy metabolism is impaired. Now, how that exactly relates to the migraines is not clear, but if you find a biochemical abnormality and it's safe to try to improve it, why not? So, what are the nutrients that improve energy metabolism? One is magnesium that I mentioned, and there are actually some randomized trials showing that magnesium prevents migraines. It reduces it by about 50%. Also, and some doctors even use this in the emergency rooms, intravenous magnesium can knock out an acute migraine in a matter of minutes. And I've done that in my practice too. But riboflavin is a cofactor for one of the enzymes in the electron transport chain. It's flavin adenine dinucleotide, or FAD. So, in theory, inadequate utilization or deficiency of riboflavin could also impair ATP production. So, back in the 1940s, there was an article, it was a letter to the editor in the British Medical Journal. And this guy said, I give people 10 milligrams 3 times a day of riboflavin, and they don't get migraines anymore. It's like, okay, that's interesting. Maybe it's a placebo. It wasn't a controlled trial. So nothing happened on that. And then 10 years later, another article, again, a letter to the editor in the British Medical Journal. And this guy was given 5 milligrams of riboflavin 3 times a day. And he said pretty much the same thing. The frequency of migraines is greatly reduced. So that was in the 50s. And nothing happened. So, some of the nutrition-oriented docs would use it. Nobody else was using it. And then in the 1990s, there was an article published in a conventional medical journal called Neurology. And it was a randomized trial. And they had 55 patients who were given either 400 milligrams of riboflavin or placebo. 400 milligrams is way more than you can absorb. So I don't think you need to take that much, but that's what they gave. And the proportion of patients who had at least a 50% reduction in migraine frequency, 59% of the people getting riboflavin had at least a 50% reduction in frequency. Only 15% of those in the placebo group had a reduction. And that was highly statistically significant. And I had occasion to use riboflavin a few times. There are a lot of things you do for migraines, primarily looking for hidden food allergies. But for those where that didn't work adequately, we'd use the magnesium and the riboflavin. One gentleman came in his 50s. He'd already tried magnesium. He was already on a diet. And so we said, let's add riboflavin. He was getting 3 or 4 migraines a month. And he didn't get them anymore after we added riboflavin. Case report, obviously weak evidence, but that's my one experience that I had using that therapy. So there are now about 5 or 6 controlled trials supporting the use of riboflavin. It doesn't seem to work that well in kids, but it works in adults. And an interesting side story, if I can indulge myself here, in 2008, I got an email from a guy named Arnold Williams. He was 80 years old. And he said, I'm a biochemist, and I have a number of friends who are neurologists. And I'm aware of the research on riboflavin and migraines, and I've gotten some of my friends to try it, and they love it. But I can't get any of my neurology friends interested in doing this therapy. Do you have any suggestions on what I should tell them? By the way, you might have heard of my late father, Roger Williams,
No.
who discovered pantothenic acid and wrote nutrition. I almost passed out on my keyboard when I read that. It's like my mentor, the son of my mentor, I'm going to be his mentor. And so we communicated for years. I haven't heard from him in the past 10 years. I don't know if he's still living, but that was just an interesting story.
That's incredible.
Yeah.
Wow. Yeah, it's certainly like you see riboflavin mentioned in treatment guidelines for migraine headaches, but it doesn't seem to be widely adopted in practice. It's quite
What does it say in the treatment guidelines?
so in the UK in the NICE treatment guidelines, it's the only nutrient I think that is recommended for migraine as a prophylactic. And from what I can see too, like the number needed to treat based on those RCTs is actually better than most prophylactic drugs. Like it's
Yes.
2.3,
Yeah.
something like that. Yeah.
Yeah. The only problem is that the drugs have a lot of money behind them. They have very large sample sizes, and the research technically is better, but they cost a fortune and they have a lot of side effects, and they don't work that well. They work okay, but so yeah, again, back to the safe stuff first,
Yeah.
and we just got to get more people interested in it.
Yeah, I think you're right. And, even though that information is there, there's like a disconnect between, clinical practice and the guidelines. Like that, this is a great example of something that technically is in the face of the neurologists or the doctors, but they're still not using it.
Yeah, who writes the guidelines in the UK?
It's a good question. It's a broad advisory committee, but they do evidence reviews as well. So it's not just opinion. Yeah.
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 Well, there's potential conflicts of interest. I know there have been studies published where the people on the advisory committees frequently either own stock or get honoraria or other kinds of money from the company that they've been charged to judge.
Yeah.
So conflicts of interest are rampant. And the problem is the people that are doing the research are the ones that are considered the experts, and somebody else comes along and they don't have the publications, but they know how to read literature and interpret it, like me. But they're not invited to be on the committees that come up with the consensus guidelines.
Yeah, yeah, you're right. You're absolutely right. You see that a lot as, looking at, the people that are writing the guidelines. It's like, why are they even on there? They have no expertise in this area.
Right.
Certainly not riboflavin. Yeah.
Yeah. So
Yeah.
riboflavin's pretty safe. It does turn your urine kind of bright yellow because the riboflavin fluoresces. Um, and other than that, so typically if I'm going to treat, I'll use like 30 milligrams 2 or 3 times a day, even though the study said 400 milligrams once a day. You can't absorb 400 milligrams at one time.
Yeah. 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 No, that makes sense. And another area I wouldn't mind quizzing you on, because you've written on it at length, both in your textbook, but also some publications over the years, and that is this topic of hidden food allergies. It feels to me like a lot of the original work on empirical elimination rechallenge diets has just been forgotten. You'd have a better perspective on that than me. And the other thing that we face today is a lot of criticism around it. Like in the UK, we have a discipline called nutritional therapy, which is very much aligned with the work that you're doing, but they're sort of dismissed by conventional dietetics as eliminating things from people's diets with no foundation. So, obviously there is history to this and there is a rational reason for it. Do you want to talk us through what you mean by hidden food allergies and the history behind it?
Yeah, well, conventionally, people look at allergy as IgE mediated. So you eat a peanut and your throat closes up and you get hives. That's the type 1 hypersensitivity. It's a rapid reaction. It can be severe, and people are usually aware of what caused it. The other type of allergy, the mechanisms are not understood, which is part of the reason people don't accept it. Um, it's People are not aware that the foods that they're eating are causing symptoms, and it's only until they pull them out of the diet and then put them back one at a time that you can discover this. So Dr. Theron Randolph wrote as early as 1924. He was the pioneer in this field, as far as I know, about the hidden food allergy. And I use the analogy of a waterlogged baseball out in the field, and when it gets rained on, it doesn't sense that water's coming down because it's already soaked. And then if you let it dry out in the sun for 3 or 4 days and then you put one drop of water on there, it will sense that water because it's dry. That's conceptually what Theron Randolph talked about, where you unmask the allergies by clearing them out of the system, because people appear to be addicted to the same foods that they're allergic to. And they often sense that eating, for example, eating wheat or eating dairy products relieves their symptoms for short term, when in fact it's just covering up their addiction withdrawal. So you unmask the allergies by clearing out all the potential common allergens at the same time. And I used a very specific diet. I taught it to about 2,000 patients. I had a person on the staff that spent most of their day teaching people how to do elimination and re-challenge. When you clear out the things for 2 or 3 weeks, the body becomes hyper alert. And again, this is all descriptive. There are actually some randomized controlled trials where they gave people food extracts in opaque capsules and they confirmed that this worked. But most of it is descriptive. So the body becomes hyper alert. And then when you test an individual food, you get a rapid and exaggerated reaction. And then you stay away from that food and you're often better. So out of the 2,000 people that I worked with, probably 80% noticed at least one food that was triggering some of their symptoms. And probably 40% of them had chronic illnesses that had not responded to other therapies, and they were able to control their problem. We're talking about arthritis, asthma, eczema, various migraines, chronic fatigue, things like that, recurrent infections. And the problem, you got to be careful with asthma and with eczema because you get an exaggerated reaction. It can be very severe and even life-threatening. But with those exceptions, it looks to be very safe to eliminate and re-challenge. I guess some of the criticism comes because people get put on an elimination diet forever with no good follow-up. The way I used to do it, was 3 weeks on the diet, test foods one at a time. If you're not sure about a reaction, test it again. And then once you're completed with this 6 to 8 week program, you have an idea which foods are bad for you and which are not. And then you can go back to a broader diet, just eliminating things. A lot of people say, well, gluten's terrible. I'm getting off of gluten. And for some people it is. But there are probably a lot of people out there that don't need to be on a gluten-free diet. So it's very, very important to do this as a diagnostic test, not as a lifetime therapy.
Yeah, that makes a lot of sense. And do you like, given that contentiousness around the mechanisms, you pointed out that IgG is a bit more clearly, you know, differentiated, I guess, from this type of approach. Do you have a sense of the mechanisms that are at play here, or like why are people reacting, and what's going on biologically?
Well, I've tried to find out, but there's very little work on that. So it
Yeah,
remains descriptive. Um, and, people who are resistant to it are not going to do it until you find a mechanism. But I have so many case reports over the years. Um, there was this guy who came in, a friend of mine who was a gastroenterologist, and he referred this patient. He says, "I have this patient with ulcerative colitis, and he thinks he's got a food allergy, but he can't figure out what it is. So I'm referring him to you, but I'm warning you, if you cure him, I'm not sending you anybody else." Uh, he was half joking, I guess. The other half, I'm not sure. Anyway, we did an elimination diet, and it turned out that this fellow, he was in his late 30s, he could be completely controlled by avoiding all substances that contain corn oil, corn syrup, uh, regular corn, nachos, popcorn, things like that. And out of about 50 patients with inflammatory bowel disease, Crohn's or ulcerative colitis, about half of them had a dramatic improvement by identifying specific foods and staying away from them. And I didn't make that up. There are at least 15 papers in the medical literature dating back at least a half a century, and some of them more recent, that says the same thing. And with Crohn's disease, you put people on an elemental diet, which is no allergens, and they go into remission.
right.
And then but the problem is they don't test one food at a time after that.
Yeah, yeah, you're right. I mean, that is such a good example of essentially what is an elimination diet, is an
Yeah,
elemental diet, really
yeah,
well-established medical therapy. People are in remission within days, and
yeah.
it's like we're not putting two and two together and thinking that that might be a sustained way to do this longer term.
Yeah, there was a patient I saw that had Crohn's disease. He was 19, and he'd been on many different medications and still suffering. And from the history, it appeared very likely that he was allergic to wheat. And in discussion, he said that his gastroenterologist had told him that if you go on Ensure, which is just a dairy product, sugar, vitamin thing, some of the patients go into remission. And it's just one of these nutritional supplements that they give to old people or malnourished people. And he never put two and two together that Ensure, despite not being very healthful, is free of eggs and wheat and corn and other common allergens. So I said to this fellow, yeah, that kind of supports the idea. And we just took him off a week because it was a good guess. He said when he went to Italy, his disease went away. And it's like, there in different countries, the wheat is made differently. In the United States, we use hybridized wheat, and it's got antigens in there that did not appear 50 or 100 years ago.
Right.
And I've had a number of friends who've told me that they're gluten sensitive in the United States, but not in UK or Italy or Israel. It's just like, wow, there's something about this food. So based on what he told me, I said, you're probably sensitive to wheat. And it turned out that he got much better just by avoiding wheat.
Hmm. Yeah, that's really interesting. Well, thanks for your insight. I mean, it's been really useful to run through these concepts and therapies. As just for listeners, in terms of like clinical application of nutritional medicine, have you got any sort of insights or takeaways from your years in the field that, would help people navigate this moving forward?
Well, the way my book is organized, it starts with fundamental principles. What is a healthful diet? Um, what is the problem with blood sugar? There's a chapter called hypoglycemia, which is a loose term for dysregulated metabolism due to sugar intolerance. And then there's a chapter on food allergy, and there's a chapter on candida. We didn't talk about that, and that's not really nutrition, but a lot of people have candida overgrowth in their intestines, and you put them on a good diet, and sometimes that's all they need, but a lot of times they need antifungal medication. And then there's a chapter on using thyroid hormone low dose empirically, which is a very controversial area. So that gives people the basics. And then I talk about each nutrient one at a time. What is it, basic biochemistry of it that's relevant to clinical medicine? What is it used for? What are the side effects? What does it interact with? What is the usual dose? So there are like 60 chapters of that. And then you get into individual diseases. There are a few hundred chapters on that. So, I guess I would say people want me to write like the Cliff Notes, the summaries, the nutrition for dummies and that stuff. And I refuse to do it because I want people to be scholarly in this field. I don't want them just to do this, weak way. So basically, my answer to your question is if you want to practice nutritional medicine and be good at it, you got to learn it. You got
Yeah.
to spend time learning it. And, start with the easy stuff. Tell people to get off of sugar and see how they feel. Do a basic elimination diet and re-challenge for some of the obvious potentials like migraines or rheumatoid arthritis and things like that and see if you get a result. And if you do, then you get more encouraged. Try some simple ones, the riboflavin for migraine or the potassium, magnesium, aspartate for fatigue or vitamin B6 for carpal tunnel syndrome. These are simple things to try. And as you see results, if you see results, which I think you will, then you get more interested in it and you study it more.
Yeah.
So that's
No,
I
that's
guess
a
that's my
that's a really
approach.
good it's a great takeaway, and I think it speaks to the way this conversation opened is that, a lot of what people are hearing out there is sort of flash in the pan information that's quite transient. It's the new latest product or whatever, and it's also the nature of our media today as well, as it's very flippant and shallow, in a sense, whereas this book is really an antidote to that. It's like deep learning in the field, with foundational concepts up front, and then really deep, dive into different chapters and topics and so forth. So I think that is a perfect takeaway. Is if you want to do this, learn it, and
Yeah,
yeah,
I mean, we spent 4 years in medical school and then at least another 3 years in residency, and people expect to take a couple weekend courses and be proficient in this. You can do some of the basics and you can help people, but not as much as you could if you really spent time on it.
yeah, yeah. No, and thank you for spending time on it and creating such an incredible resource. So just for listeners, where do they find your textbook?
Okay, well, I have a website. It's drgaby.com. That's spelled out DoctorGaby.com. And unfortunately, the cost of shipping this 8-pound book to England is $92. So a lot of people prefer the ebook just to save on that because the ebook, the download instructions are sent by email and there's no shipping charge for that. But some people like the hardcover and they just have to pay the shipping charge. That's all.
Yeah, yeah,
So yeah, drgaby.com. And there are also some sample chapters there. People can read the sample chapters and see if it resonates with them.
yeah. No, that's great. Thank you. And I just want to implore listeners, like if you're in this field, I've used very few textbooks personally, but this is one of the must-haves. Like it really is, the landmark text in the field and well worth the shipping cost. And definitely my experience is the digital version is excellent. Like it's a really great reference tool, very usable, and I'm referring to it quite a lot. So, you know, yeah, I'll link to the website in the notes. So if people want that web link and the title of the text, but other than that, I just want to thank you for your time, Dr. Gaby. That's been a really insightful overview of how you got into the field and diving through some really important concepts in nutritional medicine, and wonderful to have that insight into how this reference text evolved and its usefulness in medicine as well.
Well, thank you. It's been a pleasure meeting with you.
Yeah, no, thanks for your time.